Thank you for joining us for the third annual Global Summit, Global Kidney Innovations, Expanding Patient Choices and Outcomes, a collaborative partnership event presented by the American Association of Kidney Patients and the George Washington University School of Medicine and Health Sciences. I am Leigh-Ann Williams, an AAKP Ambassador from Louisiana. This past April marked 5 years of dialysis for me. I was diagnosed with end-stage renal disease 1 month before I was set to earn my bachelor's degree. I am currently on home hemodialysis, but I did over a year and a half in center before converting to home. The flexibility of being home has allowed me to earn 2 master's degrees while on dialysis. Being a part of AAKP allows me to learn and expand my outreach. As the largest patient-led and focused kidney organization, they provide invaluable access to resources, patient meetings, webinars, and research to educate patients, caregivers, families, congressional members, and healthcare and industry professionals. With a background in research, but also being a patient, I know firsthand the process involved in creation and development of new innovations and devices. But I understand why the patient perspective is even more important in the process. Both in the United States and globally, developers must understand that as patients, we are the ones who have to live with the innovations they develop. AAKP is a vigorous champion of patient consumer choice. This means we believe patients should not face barriers to access to kidney care solutions that best align with their ability to pursue aspirations such as work and career, having a family, home ownership, and a secure retirement. Today, I am pleased to introduce an AAKP ally and partner, Renuka Uppaluri, Vice President of Research and Development of Renal Care at Baxter International, for our session on a global need to support an ever-growing home dialysis community, innovation and access in dialysis. Ms. Uppaluri, can you tell us your view on the importance of patient consumer care choice and how it impacts the marketplace and innovation?
The key to long-term success of any therapy is to have the patient involved and engaged in their own care. However, we know that from USRDS data that 60% of incident dialysis patients end up starting dialysis on an urgent basis. And majority of them end up with a central venous catheter and start in hospital or in center hemodialysis. At this point, the patient has no choice. We believe that a comprehensive education mechanism that the patient can have access to long before they have to start any dialysis or transplant is the right way to go so that the patients are educated about their choices. And this is a problem that we face all across the globe. And at Baxter, we are addressing this by offering many digital education tools. One example of this is an app called My Kidney Plan. And the patients can download this app and go through content that's tailored for their own learning needs. And this app provides them an opportunity to explore all the various treatment choices that are available to them in a very objective fashion, so that the patients then feel empowered, educated, and confident about participating in shared decision-making with respect to their treatment.
Would you please explain the value of patient insights and engagement in next-generation product development?
As the global leader of Baxter's Renal Care R&D team, I can assure you that the first and the most important step we take before we start any product development process is to listen to the voice of the patient. We understand that kidney disease is a very personal journey and it's different for each patient. And we want to make sure that we support the patient through that journey. We also recognize that the kidney disease affects patients from people of diverse backgrounds, whether it is age, gender, geography, culture, or economic background. And we want to make sure that the products and services we develop address all of these groups. And we accomplish this by partnering with healthcare professionals and patient associations around the world. And in our product development process, we speak to user groups and we make sure our clinical trial participants represent the diversity of our patients who will use our products. And you can see this sort of partnership come through very visibly in some of the service programs we offer, such as PD Travel Club. And sometimes this sort of engagement is not so visible, but it's fully and wholly represented towards with the products and services that we offer.
How has the COVID-19 pandemic impacted your work, especially in terms of home care solutions for dialysis patients?
The COVID-19 pandemic has created a major and lasting impact for our patients. We know that kidney patients are one of the most vulnerable population, high risk with a lot of comorbidities. And even as we have the vaccine now, we know we're not out of the woods and we need to continue to keep a watchful eye. One of Baxter's priorities during this pandemic has been to make sure that we can remove any and every barrier to doing dialysis safely at home. But we also recognize that this is an effort we need to engage the community in and partner with organizations to have a healthy mix of advocacy as well as innovation. On the advocacy front, we are working and listening to key nephrologists to hear their issues around catheter placements. And we are working side by side to lobby to make sure these sorts of placements can happen in the appropriate amount of time. On the innovation front, we are working on broadening access to our remote patient management tools that we have. And as of today, we have over 43,000 patients whose dialysis information on a daily basis from home is sent to the clinicians so they can provide the therapy and the care on an ongoing basis from a remote site. And we are expanding on providing these tools so that they can not just get the basic therapy, but have enhanced care with remote patient management.
Please tell us how you stay connected with the patients and healthcare professionals you serve and how that specifically impacts our views on the burden of kidney disease.
Our mission at Baxter is to save and sustain lives. And this is our driving force, our North Star in every patient and customer engagement, every business decision we make, every product development activity that we do. We believe that we are in the business of solving critical and difficult patient problems. And we know that we can only do this successfully by engaging and partnering with the patients themselves and their care providers. So we want to thank our patients, healthcare professionals, and organizations such as yours to partner with us in fulfilling our mission.
We appreciate Ms. Uppaluri for taking the time to share her insights and experience. Thank you.